This video provides information about the National Post Form. Different states have adopted different versions of the National Post Form. For example, New York uses the MOST form, in Colorado, a MOST form, and in West Virginia, a POST form. In 2019, National Post states worked to standardize the form with the intent it would reduce confusion, provide standardization, and make it easier for people moving between states. Arizona uses the National Post form, called POST, a portable medical order. This form is currently in use in Arizona. The National Post form is a set of medical orders that gives seriously ill and frail patients more control over their end-of-life treatments in a medical crisis. This form should be filled out during a thoughtful advanced care planning conversation with a healthcare provider. A completed and signed National Post form can prevent unwanted treatment, reduce patient and family suffering, and help ensure that the individual's wishes are honored. It can also support patients who want to prolong their life to the greatest extent possible. This form is designed to be utilized by those with serious illness or frailty, such as advanced heart disease, advanced lung disease, or cancer that has spread, for whom the healthcare professional would agree that there is a good likelihood the patient may only have 1 or 2 more years to live. The National Post form complements and is not intended to replace other advanced care planning documents, such as the Health Care Directive and the Pre-Hospital Medical Care Directive. Completion of a National Post form is entirely voluntary and not mandated by law. To be valid, the National Post form must be filled out and signed by a healthcare professional, such as a physician, nurse practitioner, or physician assistant, during a conversation with an individual who is seriously ill. This form does not need to be signed by a witness or notarized. If the individual lacks the capacity to complete the form, a healthcare professional and the patient's appointed healthcare agent or surrogate decision maker can complete the National Post form and sign it based on their understanding of the individual's wishes. The National Post form can be modified or revoked verbally or in writing at any time. To modify the form, the individual needs to contact their healthcare provider and ask that the National Post form be revoked or modified. Changes to the form for an incapacitated individual can also be requested through the healthcare provider by the individual's healthcare agent or surrogate, based on new information or changes in their condition. While several states allow assisted suicide, it is not legal in Arizona currently and is not part of the National Post form. Your forms are completed and signed. What's next? Submitting your forms to the appropriate place is important so that all healthcare providers know what your wishes are. All documents should be registered with the Arizona Healthcare Directives Registry. In the state of Arizona, the National Post form needs to be attached to a healthcare directive. Visit consumers.azhdr.org/sign-up to create an account. Thank you. If you have any questions, please call 602-445-4300 or email careimprovement@azhha.org.